Hi, my name is Suzanne Rabati, and I'm the founder of MedShadow Foundation. MedShadow's mission is to educate people about the side effects of drugs and to help them balance the risks and the benefits of medicines. All medicines have a side effect, and medicines do save lives. Sometimes those side effects are worth it, but many times there are alternatives. So, if you'd like to explore what the alternatives are, today is a good day to be tuning in. We're meeting with Vickie Karian, who is a pediatric nurse practitioner, and she works at the Pediatric Headaches program at Boston Children's Hospital. Vickie just wrote a book on managing your children's headaches, and it's called Getting Ahead of Pediatric Headaches. And it's available on Amazon. We make no money if you buy it, but it's a really good reference. So Vickie has written a great article for us on how to manage your children's migraines, particularly in this time of COVID, with so many children at home doing their studying online, spending much more screen time than is probably healthy for anybody, but is unavoidable. Vickie is seeing an increase, and I'm sure many health practitioners are seeing an increase in pediatric migraines because screen time can trigger a headache. Is that so, Vickie?
Yeah, it is very much so. And it's not just migraines, it's other headaches as well. People who just have infrequent headaches find that they're having more headaches just because of the increased exposure to screen time.
So to ask a base question, how do you know the difference between a migraine and a regular headache?
Well, migraine headaches tend to have a specific spectrum of side effects or associated symptoms with them. Things like light sensitivity, sound sensitivity, even smell sensitivity. Mm-hmm. Things like visual disturbances, things like tingling in your hands and feet, nausea, things like that you don't normally experience with just a stress headache.
Good. Okay. And you do find that screen time can trigger more, and is that because of the blue light emitting from screens? Computer screens.
That's part of it. Yeah. Exposure to blue light emitted from the screens is just one of the things. Other things that can be problematic are eye strain, as well as posture issues.
Good. Well, let's start with the screen itself then. Everyone says all screens means all screens. I read on a Kindle, which is your base Kindle. It's black and white, and I read it right before I go to bed. I know we're talking about children, but I always talk about myself. Is that considered a screen?
Yeah, all screens emit blue light. Okay, there are ways to mitigate the effect of the blue light, but they all do.
And I've also heard that blue light affects children more than adults, or maybe what I really heard is as you age, blue light tends to affect you less. Is that so? Do you know anything about that?
Yeah, I believe so. But to be honest, I only deal with pediatrics, so yeah. I really can't comment on what blue light does to grownups so much, except from personal experience.
Okay. So how do you deal with blue light? What's your advice to parents on blue light?
Well, what happens is, we're always talking about sleep hygiene. And the reason why one of the things we talk about is getting off your devices a good hour before you go to bed. That's because the blue light that is emitted from the whatever device you're using, it interferes with your normal circadian rhythms, meaning it's harder to get to sleep. It disrupts sleep. And for a lot of people, that is a trigger for migraine. So that's one of the things that we always talk about with sleep hygiene. And it's even more important now that the kids are spending much more time on their screens doing their academic work.
Sure. Are there other things you can do to lower the blue light? For example, glasses.
Oh, there is a number of things that you can do to decrease your exposure to blue light. You can use a screen filter, which will decreases the exposure. And it can be either literally a physical filter that you put on the screen, or it can be a piece of software. There's a software called F.Lux that decreases the blue light, and it's free. There's devices that are actually built into some of the more up-to-date phones. There's on the Windows, I think it's called Night Shift. No, night light. And on Apple, it's called night shift that you can put on that actually makes the lighting in your device similar to the lighting in your surroundings.
Good. Okay, great.
Yeah, and there's,
So-
you know, of course, there's the blue light blocking glasses as well.
Mhm.
And they do a pretty good job of reducing the exposure.
So I've seen expensive ones. In fact, my kid bought a very expensive pair. He's a young adult and thinks that it's worth it. But I've also seen ones you can get at the drugstore for a few dollars. Is there a big difference? Is it worth it to spend the extra money if you can?
Well, I think it depends on the person. I always tell people, go to CVS and get the cheap pair or order the cheap pair off of Amazon and see if it makes a difference. Sometimes that's all you really need. If it seems to make a difference, but geez, you're still really having more trouble, then go ahead and get something a little bit more expensive, like a Theraspect or MVMT. I think it's called Movement, is a brand that a lot of my patients tell me is the best one that they like. And those are more expensive, but I would always start with the cheap one.
And if you have a screen or if you have these glasses, should you wear them all the time, all day long, or just the last couple of hours of the day?
Well, I would use them for as long as you're on the screen.
Okay, good, great. Okay, so decreasing eye strain. Eye strain can cause migraines, can cause headaches. How
Sure
do you
can.
decrease eye strain from your screen?
Well, so eye strain is basically caused by your eyes having to work harder than normal. Okay. And so then you have to think about what are the things that I can do to allow my eyes not to work so hard. So you want to have the lights in the room around the same level as the lights on your screen. So you shouldn't be sitting in a dark room with a bright screen because that makes your eyes work really hard.
I actually did not do that. I did not know that. Like when
Yeah.
I watch TV, I tend to turn all the lights off and have just the TV on, and it's probably not a great idea.
Yeah, well, especially if it's like right in front of you as well. I mean, another thing, I mean, think about this, you know, just increasing font size so that you're not having to look at small print, increase the font size. Another thing that I found for myself is that when I'm able to change the font to actually something without, they call it sans serif, meaning there isn't all these little tails on all the letters.
Yes.
All the letters are really clear. That is much easier on your eyes. So you want to have maybe just what I call a cleaner font. Maybe not New Times Roman, maybe Arial instead. It just makes it easier to read. Your eyes just aren't working so hard. And something that's really sensible, and I didn't even think of it, which was, I don't know why I didn't think of it, but just cleaning your screen. When you have dust on your screen, that means things are a little bit less clear. And so your eyes, again, are having to work harder.
Wow. There's a lot of ways that I challenge my eyes and I don't even know it.
Exactly.
I guess it's probably a good time to get your eyes checked too, because if your vision is off or isn't matching your glasses prescription, you're going to be straining your eyes a lot too.
So let me just say one thing about that is that I don't know if it's so much so for kids, but for grown-ups whose eyes, you know, you have vision challenges close up, also vision challenges far away. Having a separate pair of glasses that makes your visual acuity just right at the distance where you're sitting from your computer can make all the difference. I had to do that. I got a pair of glasses that I use just for the computer because I was either trying to look through the bottom of my lenses at the computer screen, or I was taking my glasses off and going in like this. None of that is good. And now I can't use the computer anymore unless I'm wearing my computer glasses because it accommodates my vision, adjusts my vision just to that distance. And it makes it so clear and it's so helpful.
That is a great idea. I love that idea. Not so much for kids, because most kids aren't wearing glasses. Well, not all kids are
Well,
wearing
they
glasses.
don't have that kind of a problem.
Yeah.
As we get older and our eyes get a little bit less difficult to, have a little difficult time adjusting.
Yeah, good. That's great.
Mhm.
What about posture? Does the chair you sit on, does the height of the screen all make a difference?
Yeah, all of those things make a difference. And it all has to do with your body mechanics, right? You want to be sitting up straight with your back straight and looking straight ahead at your screen. You don't want to be down like this. You don't want to be up like this, right? Because this keeps everything straight and level. Think of all the strain that comes in your neck.
Mm-hmm.
All of that. And too much strain in your neck causes neck pain. Neck pain leads to headaches of all kind and oftentimes migraine. So that's one of the biggest things. So you want to sit with your feet on the floor, spine straight, head looking, fairly straight in front of you, and with the screen maybe 20 to 30 inches away from you. And then you want to try to be as eye level as you can, because all those things will help you with your posture. And if your posture is good, then it doesn't strain your neck. You might even want to have a couple of different chairs to try a couple of chairs. I know that when we first went into lockdown, I had a chair that wasn't very great. And I've rotated a few different chairs. I finally got one of those stability ball chairs, and that one seems to be the best one.
Really?
Yeah, because it also makes me sit up straight.
I've always wanted to try that, but I never wanted to spend the money in case I didn't like it. So
it's not too bad. Yeah.
I actually have 3 different places. I've been working from home for 10 years. So I have 3 different places in my home that I move to throughout the day. And it's just because I get tired of sitting in one place.
Mm-hmm.
So it gives my back a chance to move into a different position, I guess.
Mm-hmm.
What about yoga or stretching exercises throughout the day? Does that help?
Well, anything that actually gets you out of your chair and gets you moving will help.
Mm-hmm.
So I find a lot of kids have back classes with not a lot of break in between. And that can be really hard, especially if it's 3 hours in a row in the morning. And maybe you get 5 minutes so you can get up and go to the bathroom and come back. I mean, it's a little bit of movement, but not really enough to get things, to loosen things up a bit. So, doing some yoga stretches is a good idea. Sometimes I say just, do a few jumping jacks to just get the heart moving, get the legs moving, because that helps reset you. Then you can sit down and feel a little more fresh, and you've gotten a break off the screen, your body is moved, and you feel better. But it is important to try to take even 5 minutes out of your chair every hour just to get off the screen and move.
When my husband and I started working out of home simultaneously because of COVID, we have Alexa, which makes me uncomfortable because she's always listening. But I set Alexa to come on every hour at 45 minutes after the hour to say, get up, move around, get out of your chair. And it actually works.
Yeah, that's a good idea.
You get in the habit of doing it. It does.
Mm-hmm.
Good. Well, I'm setting an alarm. I can never remember
Mm-hmm.
to do anything, so I set an alarm for everything. It
Mm-hmm.
helps. So what else should people be thinking of? I mean, I know the social isolation causes kids stress, dealing with their parents having to help with more than homework, but a lot more schoolwork. What else can you do to lower stress on kids that you see in your practice?
Well, I think so. In headache medicine, managing your lifestyle is really important. It's all about having enough to drink, getting enough exercise, getting a good night's sleep, and making sure you eat. Those things are really, really important in everyday life, managing headaches, but even more so now that we're all kind of stuck at home, right? So, making sure you have your water, making sure you have water goals so you meet your hydration needs. And one thing that's really important too is trying to do something that's a stress relieving activity, whether that's, taking a break, say you get an hour for lunch, taking 5-10 minutes and just listening to some calming music that you like, or doing a breathing exercising. Breath counting is really easy, that anybody can, it's very accessible. Laying down on the floor and stretching, anything like that can help you on a daily basis. That's always a really hard sell, to get people to do stuff like that, especially teenagers. You know, they don't want to be doing that kind of stuff. But I've actually found a lot of them a little more open to it than they were, you know, pre-pandemic. You know, they kind of recognizing that, oh yeah, I am having stress. What can I do about that stress? Oh, Vickie told me about this app 15 times already. Maybe I'll try it this time.
I know a lot of people have adopted dogs and cats during COVID, and I know you have a dog. So
I do.
I'm going to guess you'd recommend a dog for stress.
Well, it's very helpful. It's very, plus it gets you out to walk, you know, so that's helpful too. Yeah. Sometimes I usually have the kids download apps in my office just so that till I know that they did it, and I show them how to use them, some of the relaxation apps. And a lot of times the parents are right there doing the same thing. So sometimes they do these things together, which is nice, but it's also nice to be able to do these things apart. You know, a little too much togetherness sometimes.
We did actually just run an article about from another pediatrician that was talking about how to teach your child to concentrate through meditation, and introducing your child to meditation in very small increments. I mean, particularly with the child as a young age, maybe 1 minute, you know, maybe work up to 3 or 4 minutes if the child's 5, 6, 7 years old. As a teenager, maybe you can get up to 10 minutes and even longer if they get into it, but that it really does help their attention. But this was all, you know, do it with your child. And I like the idea of being able to have a little separate time and your own activities. It's your thing. Your thing is this. My thing gets to be that. So,
right.
Good. Vickie, this has been really educating and helpful, and I'm going to go get some glasses that work directly for the screen for me. I think that's a wonderful idea. Any last thoughts before we sign off?
It's just that, you know, this is the hard time for everybody. And I think that we all just have to be kind to one another.
Wow.
You know,
Kind.
We're all having a hard time, and everyone's just doing the best they can.
Those are very wise words, and I'm going to remember them. Thank you. So thank you, everyone, for watching.
Thank you very much.
This again is Med Shadow. Please come to our website and like us on Facebook, follow us on Twitter, and see Vickie's article on the similar topic online. It will be published actually on Monday, so it'll be there by the time you see that. Thank you very much.
All right. Thank you. Thank you very much for the opportunity.
Okay, great. Bye-bye.